The new ability to identify lipid core plaques in the coronary arteries has led to some very interesting findings about stenting. In general, a stent is placed in an artery without knowing if there's lipid core there. But we have here a very interesting case in which it was reported that stent landing in a lipid core plaque caused difficulties. The case is a 63-year-old male who had an occluded right coronary as shown on the angiogram. A bare metal stent was placed with no difficulties, and an IVUS was performed after the stent to show that it was well expanded. Despite everything looking fine, the patient developed chest pain 8 hours later and was returned to the cath lab. There was an occlusion of the right coronary artery at the site of the stenting, and this thrombus was removed from the artery. So this was a bit of a mystery. Why would a thrombotic occlusion occur so soon after stenting? At this point, a IVUS was done and showed that the stent was well expanded, and then a near-infrared measurement of lipid core was performed in the same artery. As shown here, the stent, which is indicated by the lines on the chemogram, landed in the middle of a lipid core plaque. Therefore, this leads to the question, would it be better to stent longer and not have the edge end in the lipid core plaque, or alternatively, is some special type of procedure needed when any part of the stent lands in a lipid core plaque? There are autopsy studies showing that a stent over a lipid core plaque heals poorly and hence might be more thrombogenic. So in summary, a stent was placed that was well expanded, a thrombus developed acutely, and the near-infrared revealed that the stent edge landed in that lipid core plaque. It's possible that the lipid cores, which are known to be thrombogenic, can increase the difficulty of thrombus occurring after stenting.